Let's discuss arterial supply of the lower limb. In this discussion, we will be discussing the origin, the termination of the artery and its branches. First, we will be discussing the femoral artery, which is the first branch to supply the lower limb. So the femoral artery is basically the continuation of the external iliac artery, which is the branch of common iliac artery. Okay, so when external iliac artery come deep to the inguinal ligament at the mid inguinal point, it becomes or it continue as femoral artery. Okay, so femoral artery gives branches in the proximal third, in its proximal third, and one artery in the in its lower portion. Okay, so these are the branches uh, which are coming out of the femoral artery. Okay, so these three branches, the first three branches, they are superficial branches: superficial epigastric artery, superficial circumflex iliac artery, superficial external pudendal artery. These branches are for the inguinal region supply. Okay, these two, deep external pudendal artery and profunda femoris artery, these are the deep branches and these are superficial branches. Okay, so the profunda femoris artery, which is the deep branch of the femoral artery, further give three branches: lateral circumflex femoral artery, medial circumflex femoral artery, and perforating arteries. Okay, so these branches from the femoral artery originates from the proximal portion of the artery, and the proximal portion of the artery is lies in the femoral triangle. Okay, lateral to the vein and medial to the femoral nerve. Okay, so these branches are from in the femoral triangle, while the descending genicular artery, this branch originates from the femoral artery in the adductor canal. Okay, and it originates from the lower portion of the femoral artery. Okay, so these are the branches of the femoral artery. Now the femoral artery, when it comes into the adductor hiatus, which is at the medial lower portion of the thigh. Okay, medial portion or medial side of the thigh, at the lower part. Okay, we will also demonstrate it in the diagram. So the femoral artery continue as popliteal artery in the adductor hiatus. Okay, so popliteal artery is present or located in the popliteal fossa, and it is the deep structure of the popliteal fossa. Okay, so the deep structure of the popliteal fossa is popliteal artery, and popliteal artery, uh, after passing into the popliteal fossa, it terminates into two branches: interior tibial artery and posterior tibial artery. Interior tibial artery is the artery supplying the extensor compartment of the leg. Okay, extensor compartment of the leg, and dorsum of the foot also. Okay, while the posterior tibial artery is for the flexor compartment. Okay, it is for the flexor compartment, or it is for the posterior compartment and the lateral compartment. Okay, so the popliteal artery in the popliteal fossa gives branches which are genicular branches, and genicular branches are four in number: superior medial genicular, inferior medial genicular, superior lateral genicular, and inferior lateral genicular arteries. We will demonstrate it in the diagrams. Okay, in the popliteal, when it passes in the popliteal fossa, so in the lower border or in the lower part of the popliteal fossa, this popliteal artery divides into interior tibial artery and posterior tibial artery. The interior tibial artery is the artery of the interior compartment or the extensor compartment. Okay, so but it first, the proximal part is in the posterior compartment, but it passes in the interosseous membrane to comes into the interior compartment. Okay, and it give branches like tibial recurrent arteries. It is from the proximal part. The muscular branches, malleolar arteries or malleolar branches, and then interior tibial artery continue as dorsalis pedis artery. And where it continues as dorsalis pedis artery, it is at the interior part of the ankle joint. Interior to ankle joint, it continues as dorsalis pedis artery, and then dorsalis pedis artery supplies the dorsum of the foot. Dorsum of foot. Okay, by giving like branches, medial tarsal arcuate artery, dorsalis pedis artery, yes, medial tarsal and lateral tarsal arteries. So these are the branches of dorsalis pedis artery supplying the dorsum. We will demonstrate it in the diagram. Then the popliteal artery, one terminal branch is interior tibial artery and the second is posterior tibial artery. Posterior tibial arteries remains in the posterior compartment, and it supplies the posterior compartment as well as the lateral compartment of the leg plus the plantar surface of the foot. Okay, so posterior artery, tibial artery then terminates in the flexor, behind the flexor retinaculum, and behind the medial malleolus, into the medial plantar artery and the lateral plantar artery, which supplies the plantar foot. Okay, now the branches of the posterior tibial artery. So posterior tibial artery, when originates from the popliteal artery, it give branch called fibular or peroneal artery, and it supplies the lateral compartment of the leg. Okay, then circumflex fibular artery, muscular branches. Okay, these two branches, fibular artery and circumflex fibular artery, it originates from the proximal portion or proximal part of the posterior tibial artery, while muscular branches originates from the middle part, and medial malleolar branch and calcaneal branch is from distal part of the posterior tibial artery. Okay, so these are the arterial supply of the lower limb. Now let's demonstrate it in the diagram. So this is the atlas showing the arterial supply of the lower limb. Okay, so first is the femoral artery. You can see this is the femoral artery. Okay, wait. So this is the external iliac artery, you can see it. Okay, and when external iliac arteries comes to the behind the inguinal ligament at the mid-inguinal point, and mid-inguinal point is the point between superior iliac spine and pubic symphysis. Okay, so when it comes to the mid-inguinal point behind the inguinal ligament, it continue as femoral artery. Okay, this is now the name changes to femoral artery, and this femoral artery is present. This is the region where femoral triangle is located. So it lies in the femoral triangle. Medial to it is the femoral vein, while lateral to it is femoral nerve. Okay, so femoral artery gives five branches in the femoral triangle, and these are divided into superficial branches and deep branches. So what are the superficial branches? Superficial branches, superficial epigastric artery. So this is superficial epigastric artery. Superficial external pudendal artery, this one is superficial external pudendal artery. Superficial circumflex iliac artery. Okay, this is superficial circumflex iliac artery, this one. Okay, so these are the superficial branches from the femoral artery. Now the deep branches, they are two in number. Deep external pudendal, you can see it, this is the deep external pudendal. Okay, okay, so this is the, wait, this is deep external pudendal. Okay, and the main deep branch is this one, this is the deep femoral artery or profunda femoris artery. Further, profunda femoris artery give branches like medial circumflex femoral artery, okay, the lateral circumflex femoral artery, and the perforating arteries. This is the perforating arteries. Okay, okay, so these are the branches from the upper part of the femoral artery, while the from the distal part it give one branch called descending genicular artery. Okay, descending genicular artery. So after the femoral triangle, it goes into the adductor canal and comes out from the adductor hiatus. Okay, femoral artery in adductor hiatus. After the adductor hiatus, its name become the popliteal artery. Okay, so wait, now this is popliteal artery. Okay, this, now the name becomes popliteal artery, and it is lies posterior to the knee joint in the posterior triangle. Okay, in the posterior triangle. Okay, this is the popliteal artery. In the popliteal fossa, the popliteal artery give genicular branches. Medial genicular artery. Okay, sorry, this is not. Inferior medial genicular artery. Okay, superior medial genicular artery, superior lateral genicular artery, and inferior lateral genicular artery. So genicular branches arises from the popliteal artery in the popliteal fossa. So at the lower border of the popliteal fossa, you can see it divided into posterior tibial. This is posterior tibial, and this one is interior tibial. Okay, interior tibial artery, here it passes through the interosseous membrane and it becomes interior. Okay, it becomes interior. So this is now interior tibial artery in the interior compartment of the leg, while the posterior tibial artery remains in the posterior compartment. Interior tibial artery in the this passes in the interior compartment of the leg, and when it comes to the interior portion of the ankle joint, then it continue as this. Now this artery is dorsalis pedis artery. Okay, this artery is dorsalis pedis artery, and dorsalis pedis pulse can be felt between the first and second toe or first web space. Okay, superior to the first web space. So this is dorsalis pedis artery. Branches from the interior tibial artery is tibial recurrent artery, two tibial recurrent artery from the proximal portion, muscular branches in from the middle portion, and malleolar arteries from the distal portion. So the recurrent artery are interior tibial recurrent and posterior tibial recurrent. Okay, so this is interior tibial recurrent, and posteriorly there is posterior tibial recurrent. Okay, so this is from the upper part while muscular branches are from the middle part, while in the lower part or the distal part it gives two malleolar branches, interior medial malleolar and interior lateral malleolar artery. Okay, so these are the branches from the interior tibial. Now coming to the posterior tibial artery. So posterior tibial artery, this is posterior tibial artery, this, and posterior tibial artery continues in the posterior compartment of the leg, and it passes behind the medial malleolus and behind the flexor retinaculum, and it then divided into two terminal branches, lateral and medial plantar arteries. Okay, so this is the course of the posterior tibial artery. Now the posterior tibial artery, the main branch is this one. This is fibular artery. Okay, this one is fibular artery, and it continue in the posterior lateral compartment posteriorly. Okay, this one posterior, it is posterior lateral. Now the second branch of the posterior tibial artery is circumflex fibular artery. This one is circumflex fibular artery. Okay, circumflex fibular artery. Then in the middle it give muscular branches, while in the distally it give medial malleolar branch, which is not showing here. Okay, and then calcaneal branch, and it terminate as medial and lateral plantar artery. Now in this figure you can see the posterior compartment. This is the posterior compartment of the leg, showing the, this is the posterior tibial artery. You can see it, this is the posterior tibial artery. Okay, and this one is, this artery is popliteal artery, but in the lower half of the lower border of the popliteal fossa, it terminates into popliteal artery, and this posterior tibial, and this one which goes to the interior compartment through the interosseous membrane. This is the interior tibial artery, the proximal portion. This posterior tibial artery uh, continue in the posterior compartment of the leg to pass deep to the flexor retinaculum, and it terminates into two branches. This is lateral plantar artery, and this one is medial plantar artery. Okay, in the proximal part it gives two branches, fibular artery and the circumflex fibular artery. In this figure fibular artery is here, it continue in the lateral compartment. Okay, while from the distal part it gives two branches, medial malleolar branch and calcaneal branch. Okay, so this is, you can see it, this is calcaneal branch showing in this. Okay, so this is all about the arterial supply of the leg. Okay.